What are refractive errors? I'll start by talking about the structure of the eye so that people can understand what a refractive error is. So your eye is like a ball, roughly shaped like a ball, and inside the eye there's a crystalline lens. So this crystalline lens is pretty much like a lens in a camera. The way a camera works, when you click on that light, the light is focused onto the film of the camera. It is focused by this lens, and that's what helps to make sure that the image falls on the film correctly. So the eye pretty much works like that. When you're looking at something, that something is reflecting some light which goes into your eye, and the eye focuses this light onto your retina, which is at the back of your eye. Okay, so a refractive error comes about when your lens is either too strong, in the sense that it's more curved than an average person, or it's not as curved as an average person. So the light tends to be focused either in front of the retina or behind the retina. So I'm sure you've heard about people who are short-sighted, long-sighted, or others say far-sighted. It's because of where the light, the image gets focused onto. The light gets focused on the retina. So for someone who is short-sighted, the light gets focused in front of the retina. And so they are able to see images that are close to them, but they can't see far away. And then for someone who is far-sighted, it's the opposite. They are able to see things that are far away much better than things that are close to them. Okay, so that is what being short-sighted and far-sighted is. And those are the two that people know about the most. But we also have something called astigmatism. With astigmatism, it's all to do with the shape of the eye itself. So it tends to be shaped more like a rugby rather than a football. So because of that altered shape, the light gets focused in two different places. So someone with astigmatism tends to have a very blurry image because one is focused on one side, the other is focused on another side. So that's what we call astigmatism. Then the fourth one is called presbyopia, the other type of refractive error. It's called presbyopia, and this happens to all of us after the age of 40. Okay, so you find that as you start approaching your 40s, it becomes difficult to read fine print. You pick up a box in ShopRite, you want to read what the label says, you can't read because you've developed this condition. Or you want to read the newspaper, but you're struggling, you have to hold the newspaper here. You know, that's what we call presbyopia. So as we age, the lens tends to lose its ability to do what we call accommodation, meaning that it's supposed to alter its shape to allow you to read that fine print. But as we grow older, the ability to do that accommodation gets reduced, and so that's why we're unable to read that fine print. But these are things that are easily correctable, and we'll talk about the correction as we go. So you find that depending on the region that you are coming from, the type of refractive error which is common is different. So in the Asian population, they are more likely to be far-sighted, okay, because of the way their eyes are shaped. Then in the African population, we are more likely to be short-sighted. But you find that over the past 3 or 4 decades, things have changed because of the use of gadgets. We have developed this habit of using gadgets so much that myopia is now slowly becoming like an epidemic. People are developing myopia or short-sightedness at a very young age, because from 6 months, when a child is disturbing you, what do? Just give them the tablets or the phone. And it's becoming such a habit. But for the Asian population, because as you may be aware, their system of learning is so rigorous such that from a very young age, they do a lot of reading. And so they tend to develop this short-sightedness more than the rest of the world. But I mentioned earlier that farsightedness is more common there because of the shape of their eyes. But over the past few decades, you find that myopia has slowly taken over because of this use of tablets, use of phones, and a lot of reading. Very competitive nature of the world that we live in. Yes. Um, so it's not possible to say which type of refractive error is common in a region because it's very region specific. Some regions may have more myopia, others may have more hyperopia, others may have a mixture of astigmatism with short-sightedness and things like that. But coming down to our local situation, I was privileged to conduct a study while I was doing my Master of Medicine program. So I conducted the study at University of Zambia School of Medicine, and of the 200 or so students that participated in the study, 67% of them had some form of refractive error. Okay, they were short-sighted, long-sighted, or had some form of astigmatism. Okay. In this study, I was collecting information about any refractive error, no matter how small it is. So 67% includes those who have even a small refractive error that doesn't need correction, all the way up to a very high refractive error, which is much higher than what you would expect. So it's that common. Then also, well, I'll talk about the risk factors. The risk factors for refractive errors, again, it depends on which refractive error we're talking about. So the major risk factor for short-sightedness is indoor activity and doing a lot of near work. So those who are mostly indoors and spend most of their time doing near work, like they do reading, they do a lot of screen time on their tablets, their TVs, those who are indoors are more likely to develop short-sightedness compared to those who are found outdoors, playing outside and doing outdoor activities. The reason is that when you're outdoors, you're forced to look far away, and your eyes tend to adjust to that looking far away. But for those people who spend most of their time inside, I mean, most of our houses can't be bigger than 6 meters. If you're sitting in your living room, I doubt it's bigger than 6 meters. So whatever you're doing, it's within a 3-meter radius. So your eyes tend to also adapt to that environment where you are. So you adapt to seeing things that are near, and when you go outside to look at things that are far away, it becomes a challenge for you because your eyes are so used to being near. A few studies have shown that you may be at risk if your parents also have this short-sightedness. Okay, so there was a large study, the Framingham Eye Study, that was done in the 1960s, which showed some genetic link. The parents who were short-sighted, their children were also studied, and they found that a large number of them also had short-sightedness. So there may be a genetic component. So if your parent is short-sighted, there's a likelihood that one or more of the children may also be short-sighted. So those are the major risk factors for short-sightedness. For far-sightedness, the major risk factor is having a small eye. So like our Asian counterparts, that's why they are more at risk, because naturally they've got smaller eyes than the rest of us. So you find that even if their lens focuses the light on the retina, it tends to overshoot to the back of the retina because of the size of the eye. So those are some of the risk factors. Then for short-sightedness, again, the older we grow, the more we are prone to developing a condition called cataract, where our natural lens becomes white. So because of that cataract developing, it alters the shape of the eye, so much so that it focuses light a bit too much compared to what it should. So as someone develops a cataract, they are more likely to be more short-sighted than an average person. So that is another risk. So those are some of the risk factors for developing refractive errors. So how you can prevent refractive errors? Like I've mentioned, for short-sightedness, the best you can do for yourself is to avoid a lot of near work. especially for children. It's slowly becoming an epidemic, like I mentioned. And short-sightedness is in grades. What I mean is that you can be slightly short-sighted or you can be very short-sighted, and that would determine the type of corrective lens that you are going to get. So you find that in the olden days, even if someone was short-sighted, their lens would be a thin lens. But now we have to use very thick lenses because the grade of the refractive error is so much. So the best one can do for themselves is to avoid doing a lot of near work. Find alternatives for children to play with. Let them play outdoors. Let them do things that don't involve a lot of near work. Okay? Of course, they are going to school, they are spending most of their day at school, they are reading, and they are doing a lot of writing, which involves focusing on their books. But when they come home, let them do something else, not just screens all the time. And that goes for the rest of us as well. The less time we spend on our screens, the better for our eyes. Then for farsightedness, there isn't much that we can do about the shape of the eye, So for prevention, there isn't much that can be done, but one should seek help as soon as they notice that seeing close things is a challenge for them, because that tends to lead to headaches, because you're forcing the eyes to strain for them to be able to see something that is near. So the more you keep on straining, you keep on developing headaches, the more you really need to have the issue corrected by way of wearing glasses. And if you ignore the problem, it keeps getting worse with time. The treatment for refractive errors is simply by use of spectacles. And spectacles are affordable for the majority of the population. I mean, a lot of us go to town, to shops, and we buy things worth 100 kwacha, 200 kwacha. But when we are found with these refractive errors, we say 100 kwacha is too much for me, 200 kwacha is too much for me. But this is your eye health, you have to be concerned about your eye health. There's no one who is more concerned about your health than yourself. So you just have to make it a priority and get the glasses that have been prescribed for you. So what glasses do is to help the light to focus on the correct position on the retina. Okay, so for those who are short-sighted, the spectacles will help them to focus the light farther than where it's being focused. And then for those who are short-sighted, it will bring the light closer to the retina than their own eyes can do. So for people who need the glasses, it's a must. They have to wear the glasses. Otherwise, they will keep on having the symptoms that come with not wearing glasses. And some of these symptoms are blurred vision. Number 2, headaches. Those people who are supposed to wear glasses and they're not wearing glasses, they're putting a strain on their eyes. So obviously they're going to have symptoms of headache, because that is a warning sign that something is wrong and they need to have their eyes checked. Then the other symptom is it's pretty much non-specific. I think only someone who needs glasses can explain to you. When they're not wearing glasses, there's just something funny about their sight, It just feels unusual. We call those astenotic symptoms. They're difficult to put into words, but the eyes just don't feel normal until they put on their glasses. Then they're going to feel like they are seeing properly. So when you start wearing your glasses, that is a simple treatment, but we have other treatments that are available. Apart from just the spectacles that we are all familiar with, there are also contact lenses. So contact lenses are an option for those who can afford them, and for those who are able to take care of them very well. So it's not really advisable for a child to be putting on contact lenses, because of all the care that is involved in caring for contact lenses, unless that is the only option. Then the other option available is laser treatment. There's what we call refractive surgery. So there is surgery available to correct either short-sightedness or long-sightedness, or some forms of astigmatism can be corrected by refractive surgery. So what refractive surgery does is to take away a portion of the front part of the eye called the cornea. Okay, so it chips away a part of it so that it develops the correct strength for focusing the light. That is all that laser treatment does. Instead of you adding another lens to do that focusing for you, the cornea is adjusted to meet your needs. So laser treatment, depending on how it's done, sometimes it may be permanent, or with time you may still need glasses. Okay, it all depends. It's very individualized and also depends on the skill of the surgeon who has done it. But unfortunately, it's not available in young ones. It's only available roughly after the age of 25. That's when most people are comfortable to do refractive surgery, because at that point we expect that the refractive error is very stable and it's unlikely to change. But if someone is younger than that, there's a likelihood that you do the laser this year, next year the refractive error changes and you have to do it all over again. And of course nobody wants that attached to their name, that they did surgery and then next year the patient came back. This is very expensive surgery, so you don't want to be doing it every so often. I like talking about children because there's no one to speak for them, and most of the time they are not able to voice out what they are feeling. A child will not be able to see something far away. They are able to see nearby, but they will not know that it's wrong. They'll think it's normal. The fact that they're able to see something close by, to them, they probably think everyone else must be seeing the same thing. Okay, so it's good to have your children checked for a refractive error, especially before they start school. In other places, it's mandatory. Every child who is starting school must be checked for glasses, because in children you find that the performance maybe is not up to par simply because the child is not able to see properly, and the parents will just be saying, no, this child is not able to grasp what they're learning in class, and yet maybe it's just because they are not able to see properly on the board or even in their books. I've had situations where a child keeps on missing letters. When they're copying on the board, they keep missing letters because they're not able to see properly. But the moment you come and have them checked, you find that it's a refractive error. They start wearing their glasses. They start even seeing all the letters on the board. They don't miss anything. So I would highly encourage parents that all the children who are going to school, before they start, have them checked for glasses. At least just rule it out. There's no harm in just ruling it out. Then for the adults, you're having blurred vision, you're not able to see things clearly, just have your eyes checked for glasses. It's quite unfortunate that, as easy as this solution sounds, most people don't wear their glasses even when they are prescribed, because of some myths that maybe you look ugly, or there's another myth that if you wear glasses then you must be very intelligent. So maybe you find that you're not in the top performing students in the class, but you wear glasses. You feel like people are not going to take that very kindly. Then there's also the myth of glasses are going to spoil your eyes. I'm not going to allow my child to wear glasses because once they start, their eyes are going to get damaged. But what you're doing is actually the opposite. If the child has a refractive error and you're not letting them wear glasses, you're causing more damage. What will happen is that the refractive error will keep on getting worse, and it may even reach a point where glasses will not help. Their vision would have deteriorated so much that even if they wear glasses, the vision will not improve much. There isn't really any medication for correction of refractive error because, like I mentioned in the beginning, the problem is with the focusing of light onto the retina at the back of your eye. So there isn't any medication that can help to somehow alter the status of the lens so that it can focus the light better. There isn't any such medication.